I'm State Representative David Millard, representing the 109th District in Columbia County. And welcome to my 12th annual Senior Expo, an expo that provides a lot of our seniors with knowledge of programs, local, state, and federal, that they may be entitled to. A lot of tax dollars in Pennsylvania are dedicated to helping our seniors. And this is clearly evidence from the group that's here today that they are interested in those programs. And certainly as their state representative, we want to make them aware of all the programs that are available to them. So again, welcome to Legislative Report. I'm with Columbia County District Attorney Tom Leipold. The District Attorney's Office and my legislative office have cooperated on a number of issues that affect each and every one of our communities, but specifically we're dealing with those in Columbia County. District Attorney Leipold, would you like to let our viewers know exactly the information that you're providing here today at this Senior Expo?
I would, Dave. Thank you very much. This kind of forum is a great opportunity that I can push one of my messages that I'm most concerned about, which is the proliferation of prescription drugs. In our communities, we're flooded with prescription drugs, and if they're not kept secure in your home, they can be taken by your children, your grandchildren, friends who come to visit. If they're in a medicine cabinet and someone goes to the bathroom and uses it, you can be pilfered and you have your pills cleaned out and not know it till the next day or 2 days later. And those things are then spread through the community. Tylenol 3s these days sell in the junior high for $5 a piece. And so one of my big goals is to try to educate people to get the things, if they're in your house and you take them, keep them secure. If you're not taking them, get rid of them. We have drug collection boxes in our communities that my office obtained through a grant last year. One's in the Berwick Police Station, one's in the Bloomsburg Police Station. They're secure disposal facilities. They're available 24/7. And the items that are taken from the boxes are then stored securely until they're taken for environmentally safe disposal. In fact, we have several hundred pounds being taken for disposal tomorrow, as a matter of fact.
Wow, that's great.
And that's a couple months collections.
Great.
So there's a lot here, but there's still a lot to get rid of.
Very good.
So that's one of my important messages today.
And on that same topic, we actually had an individual, when they came through the door this morning, mention that this would be a wonderful venue to have that exact same item set up where it's under your control, and that it would be disposed of, in accordance with all the disposal rules and regulations. And I think that, at each of these expos every year, we always try to provide the public, the seniors, exposure to the programs that are available to them. But I think that that's an added benefit to having an exposition like this, that we can also do a collection of those prescription meds right here at your table, because you're with us every year, and they'll be dealt with when they come here to see the programs that are available to them.
That is a great idea. In fact, my wife actually mentioned that to me a week or so ago. Oh, it would be good to do that. And I said, well, that takes advanced planning and advertisement so people know to bring their stuff. Yep. That's definitely a good idea for next year. We can have a police officer here and a secure box here, and folks can bring the stuff in and get rid of it, and it's securely provided for.
Very good, and we'll work together as we always do on everything else. We'll make that an added item that will be available next year at the Expo. And one other thing that I wanted to focus on, when I mentioned that we do a lot of cooperating on a variety of items throughout the year, one thing that we have done that has been very successful, and we've had several of the seminars, is on concealed carry. And if you'd like to provide our listeners with what the purpose of that seminar is and exactly what we accomplish or hope to accomplish by doing them.
I absolutely would. Thanks, Dave. In our county, we have an awful lot of gun owners, and they always like to know the most recent information on the laws that apply to gun use, gun ownership, and the carrying of guns. And so your office, along with Sheriff Tim Chamberlain and I, have been presenting a series of programs around the county to educate people on what the laws are governing concealed carry and open carry of firearms, and also the law relating to self-defense and the use of firearms. Of course, a couple of years ago, the laws in Pennsylvania were changed a little bit by the stand your ground provisions and some modifications to the Castle Doctrine. And so we've been going around the community to different venues and explaining that. The response has been great. We've had standing room only crowds everywhere we've gone, and very enthusiastic response afterward, which is really rewarding.
And just a side note, when we started doing these programs, I don't think that we realized or gauged exactly the popularity of the program, and we've actually done several of them and continue to do them. So we're just to highlight again the cooperation that certainly as a state legislator that I have with our county district attorney in serving the public. And we want to thank you for that cooperation.
I'm always happy to help when I can, and I certainly appreciate your help always, Dave.
Thanks, Tom. With me is Bob Mambeck from United Water of Pennsylvania. And I have Bob on our program today to explain and highlight the importance of working together when you're trying to accomplish something that has a high ticket value and of great importance in any given community. And Bob, we've worked together over the past couple of years on an item that I'll let you talk about that is going to be located in the geographic area of Bloomsburg. And United Water of Pennsylvania has served Bloomsburg and the surrounding communities for an awful long time. And we're embarking and knee-deep right now in a new project. So if you'd like to let our listening audience know exactly what we're doing.
Sure. We are pleased to state that we're investing $35 million in new technology that will provide the highest quality of water possible for United Water customers in Bloomsburg and 4 surrounding communities. And the reason we're doing this is because for many years we've known it's imperative to have a plant like this up above the floodplain because of the history of recent flooding here in this area. We look at this as an investment that will bring untold dividends to both business and industry for decades to come, as well as residential water users. We're grateful to you and to other public officials at the local level, at the state level, for working with us in order to accept our plans and our design.
Well, thank you for those comments and information. And Senator John Gordner also was very instrumental in bringing all of this together along with United Water and our county officials. And as Bob Mambeck mentioned to you, the whole purpose of this was to provide reliability and service and certainly quality of water. And when you're looking at a water system, a water facility that United Water of Pennsylvania acquired that really served the community over 100 years, we certainly know that those rules and everything through water quality and DEP and EPA, all of those agencies that have their fingers involved in water quality has changed over those years. And if you'd like to just let us know a little bit of the intricacy of the plant and specifically what type of a system it is.
Yes. DEP has, of course, determined the extent by which we will insert the treatment and filtration equipment. And so what we have are essentially 2 systems that are innovative technology. One is super pulsation, which actually will ensure that the water is treated relatively quickly. And we'll also have ultraviolet light, which of course quickly eliminates bacteriological concerns that we find in the raw water. Now, our source of supply still will be Fishing Creek, but we're going to also have wet well pumps that are submersible that will be able to withstand flooding in the future, unlike before. Again, this is advanced, innovative technology, very expensive, but nonetheless, when we do things like this, we want to do them right. We want to make the investment last for decades to come without having to go back and retrofit.
Very good. And we broke ground for it last fall. And what's the expected completion date?
We did indeed break ground last October, and the expected completion date will be July now of 2016 because of an extension of time we need to get some of the more sophisticated pumps in.
Very good. Well, thank you very much for providing that information and that update. And again, to our listening audience here, or viewing audience, just another example of working together, whether it's private industry or officials working from one elected office to another, what we can accomplish in a community. We're all here to serve the good of the community, and certainly, again, a prime example. Thank you again, Bob. As a legislator, when you put on a senior expo, you always want to make sure that you're accomplishing what your goals are. And one way of doing that to gauge your responsiveness to programs that are available to seniors is just go right to the source. Ask the seniors. Doris, with this Senior Expo, you've been here more than one time, and has this been a benefit to you?
Yes, it has, definitely. I've learned a lot by coming to it. Very much so.
And Bill, you've also been here to a couple expos, and mentioned to me before that one of the benefits of coming is that program guidelines can change from year to year, and have you found this to be a benefit for the seniors in our area?
Oh yeah, I come every year since you've had it actually, and I get a lot of good information about senior citizens. So there's a lot of information out there, and you know, people come and they should go around and check all the good information that's available at this expo.
And Elaine, we've had a variety of vendors here throughout the years and information that they provide, and I know that as you go through each of the booths and talk to those individuals, have you found it to be beneficial in providing you the information?
It's very beneficial. You can collectively get a lot of stuff that you would not get otherwise. It's all here at one place, and I look forward to it. Information that's very valuable from the police, the vendors that sell different things that you wouldn't be able to get otherwise. And with the fact that I'm here for the third year, and I find it very useful.
Very good. And again, one of the things that we try to highlight when we promote this event is the fact that guidelines for programs do change from year to year. So we do encourage seniors to come, not only year after year, bring their friends and share that information with their friends and neighbors. And here's some additional information from various vendors associated with this event.
My name is Bridget Klinger, and I'm the Director of Veterans Affairs for Columbia County.
Can you tell us some of the information that you're providing today, and maybe some things that folks may not know?
Well, folks don't know there is a veterans representative in every single county in Pennsylvania. And what I'm trying to get across today is we can help veterans with all their paperwork to fill out their compensation claims. They could be eligible for a pension, VA health care, some in-home care. There's a big list of things that people just don't know are out there.
And I would assume, too, this applies for someone just coming back from service, too, someone who's younger as well. What advice would you give to somebody who's just coming back and just finishing their service?
I would tell them to definitely get in and file a VA claim. A lot of people wait 40 or 50 years, and by that time it's a little too late. So definitely the best advice is just file a claim so you're at least in the system.
And you mentioned the various programs. What types? I see there's one here for caregiver support. Can you talk a little bit about that one?
Well, that's actually through the Wilkes-Barre VA. We refer people up there, and they have caregivers who will come out, for companionship and help and do anything that a veteran might need around the home.
And I guess also health care you mentioned, and pension as well. Is any veteran able to receive those type of benefits?
Not every veteran. They have to have at least one day in a wartime period. And for the VA healthcare, they do go by income limits. That's determined up there when we send the application in, but almost every veteran is eligible for these services.
And then can you just give a summary statement, I guess, about encouraging folks to find out more about what is available to them, because certainly they have earned it.
Oh boy. I don't know. I would really encourage everybody in any county to get in and talk to their representative, because you never know what you could be eligible for. And the claims do take a long time. They could take up to a year. But if you're in the system, things just go a lot smoother for you.
I'm Becky Stender from Central Susquehanna Opportunities Community Action Agency. We have an office here in Bloomsburg and in Shamokin, and we are here with our SNAP outreach program. SNAP is more commonly known as food stamps, and we do assist people of all ages with the application. We do home visits, we do site visits, and we do also do the application over the phone, whatever is most convenient for the consumer.
Can you tell us a little bit about the LIHEAP and the other home heating programs that you have?
Yes, we also help with LIHEAP applications when they are in season. We also have a program called CSO Cares for Savings, and that is a program that encourages savings towards your heating costs. It's a dollar for dollar match for the program up to $400, so a person could potentially have up to $800 saved towards their heating costs after completion of the program.
And can you explain what LIHEAP is for those who don't know?
Yep, LIHEAP is the low income energy heating assistance program, and that assists people at a certain income bracket towards heating costs. It's credited towards their heating provider, whether that be oil, electric, natural gas, coal, whatever they use to heat their home.
And you had mentioned earlier some counseling services isn't the right word, but you help people learn how to better budget. Can you talk about that?
Yep, we do have a financial literacy program as well. We cover a variety of different topics from basic budgeting. We also do topics about identity theft and credit reporting and just about living a financially more sound life.
And we're here today specifically for seniors. Any things that seniors in particular really should know?
Just give us a call and see what offices or what services we can help out with. We help all age groups. Seniors sometimes don't think that they qualify for things, but you never know until you ask.
And then how can people contact you?
They can contact us by calling one of our two offices. Our main office in Shamokin is 570-644-6575, and our Bloomsburg office is 570-412-2830.
My name is Kim Smith. I am a safety press officer for PennDot, District 3 in Montoursville. Today I'm promoting traffic safety, particularly the Yellow Dot program, which is a free program. It comes with a sticker that you put in the back of the window of your car. Inside your glove box, you can put important medical information about yourself or your loved ones. So medications you're on, allergies you might have. If you get into a crash or first responders are called to help you, they see the sticker and they know to look in your glove box for that important information. So it's a great program, it's free of charge, and we're really promoting that today.
We're here specifically for seniors today. So what are some of the information that you have that really speaks to senior citizens and driving?
Right. So we're talking about the effects of your medication on your driving, different programs that we have, how to maneuver some work zones safely, reminders about how to maneuver around roundabouts safely, and also how to pick an appropriate car for you and for your needs. And then also, because so many of our seniors are grandparents or great-grandparents, we have some child safety seat information for them today as well.
And I never really thought about the type of car. Can you give us some information about what types of cars might be better for seniors?
Right, we really want to make sure that the car fits the senior. So they might need to have some things like some extenders for the gas pedal and for the brake pedals to help them reach it better. Make sure that they're able to use their mirrors and sit in the seat properly and high enough that they can see out. So not every car is designed the same way, and so you might need to adjust what car you drive to fit your needs.
And then what kind of questions should a senior ask themselves when they're wondering, should I still be driving or should I give that up?
Right. So they're going to ask themselves, or do they get confused? Do they get lost in roads that they should know? Do they sometimes not know where they're going? Are they having trouble with their vision, or are they on any medications that can make them drowsy or dizzy? They should always talk to the doctor about any medical conditions that they have, and talk to the doctor about driving. And it might be time to give it up if those medications will affect you.
And what would you say to someone who has parents as seniors and they're wondering the same thing? How can they help their parents come to that decision?
Right. So you want to talk to the doctor as well. You want to go with them to their appointments and talk to the doctor and just have a heart-to-heart and tell them your concerns. You can go online to justdrivepa.com, and there's important information on there about older drivers. So there's some guidelines to help you, the kind of questions you might want to ask.
Any other information that you want to share with us today that you haven't discussed yet?
I just want to remind everybody that it's important to buckle up every seat, every time.
And how can people contact you or the department if they want more information?
Sure. So we have a website, the Pennsylvania Department of Transportation. On there, you can click on a map that shows your county, and that'll get you to the appropriate district area. And right under safety, you can find my information right there.
Thank you so much.
Welcome. Thank you.
My name is Christine Maloney Hoover. I'm a Senior Assistant Consumer Advocate with the Office of Consumer Advocate. We're an independent state agency created in 1976 to represent consumers before the Public Utility Commission.
We now have choices in a lot of things, our gas suppliers, our electric suppliers, those types of things. What type of information do you want to get out to people today about their choices?
We publish 2 shopping guides, one for natural gas and one for electric shopping. It's an apples-to-apples comparison. It'll give them the PPL price to compare and the suppliers who have offers in the PPL service territory. We always caution people to look at whether it's a fixed or variable rate. That's shown in the shopping guides. And we also caution people to see whether there's any penalty or a fee if you leave the agreement early. So that's also in the shopping guide. We have a couple of handy checklists so they can see the questions they need to ask suppliers.
So maybe some people are intimidated about choosing. Maybe they've always had the same supplier. What would you say to them?
Well, no one has to switch, but the tools that we have, plus the Commission, the Public Utility Commission has PA Power Switch. Those are tools people can use to look and see what their options are, and then they can make a choice to switch or not to switch. But at least they've looked, they've shopped, and it's their choice.
And then I see you have some energy saving tips too. What are a few that you can share with us today?
Well, actually, one of the biggest ways you can save energy if you have an electric hot water heater is looking at the temperature the hot water is on. And we also have water saving tips because electric and water usage really go hand in hand. So we have booklets for people on that. We have information about shopping for LED bulbs versus compact fluorescent. We have a toll-free number. People can call us if they need any information or have any questions about their utility bills.
And do you manage grievances if someone has a grievance with a utility company?
We cannot help them if they've received a termination notice, but we can help them anywhere up to that point. If they filed a complaint at the PUC on some other matter, we may be able to help them informally as well. We occasionally do intervene in customers' formal complaints at the PUC too, but we're certainly a resource and we can help them with just about any utility question or issue they have.
And I see you also have some information about being prepared when the electric goes out.
Yes.
What tips can you give us for that?
Well, that's important whether it's summer or winter because electricity can go out in the summer or the winter. It's really just preparing ahead of time, having water, having food storage. It doesn't have to be a lot, but just to get you through a few days if for some reason the electricity would go out.
Anything else you want to tell us about that we haven't touched on?
I don't think so. We can help with water, wastewater, natural gas, electric, and landline telecommunications. So obviously if we can't help them and they call us, we're happy to refer them to the right place. And an actual person answers the phone, so they'll always get to talk to someone.
How can folks contact you if they need more information?
They can call us toll free at 1-800-684-6560.
Thank you.
Sure.
My name is Charlotte Kettler. I'm a volunteer with CARI, which is a nonprofit organization. CARI stands for Center for the Advocacy of the Rights and Interests of the Elderly. It's dedicated to helping seniors, has a number of programs, one of which is to, like me, go around and educate seniors about ways to prevent Medicare fraud. This past July has been the 50th anniversary of Medicare. It has been around for 50 years, and Medicare fraud has been with us right from the beginning, taking money away from the Medicare, billions of money away from the Medicare program. So we go out, we make presentations, we tell seniors, please protect your Medicare number. Don't give it out to anyone you don't have good reason to trust. Safeguard your Medicare card. It has the number on it. Don't routinely carry it. Keep it tucked away until you need it. When you go to a doctor, we go to any kind of visit for the health care provider. keep a record of their appointments with the medical profession so that when the Medicare statement comes in, they can check it for any discrepancies and report any. And that all helps to stem the drain of Medicare fraud.
If someone thinks they're a victim of this fraud, what should they do?
They can report it to Medicare, 1-800-MEDICARE, or CARRY. CARRY has a toll-free number. It's there for reporting. It's there for people to call and any question, any concern that they have. If CARRY can't help directly, CARRY will refer the individual to places that can help.
Are there other topics and issues that you help seniors with?
Yeah, CARRY has a number of programs to go to nursing homes. In fact, CARRY is in charge of educating staff and residents about their rights as nursing home residents. They have programs to prevent abuse. And then they have the hotline number for any kind of concerns any senior, any caregiver, any family member may have.
Now, I would assume, since you're a volunteer, that CARRY is also looking for other volunteers. What would you say to someone that's thinking about it, or what type of skills or talents should they have?
Don't need many talents, really, just an ability to try to help and educate. And there's a training program. There's training in person, there's training on computers to get familiar with tips, techniques to stop Medicare fraud, information about Medicare itself. Can learn, constantly learn. We're constantly looking for challenges, actually. And one of the challenges is to prevent the fraud. It is outrageous. The most recent example, I'm sure people have heard of it, it's been on the national news, a Dr. Fatah, who not only took millions of dollars in Medicare fraud, but actually injured people by giving false diagnoses of cancer and having people go through very painful treatments. So fraud not only takes money away, it injures people. It can injure people. That's why we're trying to get the message out. Do everything we all can, especially our seniors, in protecting the Medicare number, the Medicare card, in stopping fraud. Because once some unscrupulous people get hold of that Medicare number, they can bill Medicare for services our seniors may never see.
And one more time, how can people contact you?
They can call CARRY, 1-800-356-3606. The nice thing is that phone is answered by real life people. It's not an automated system like Medicare is, 1-800-MEDICARE. So we encourage people to call.
Thank you so much.
Thank you very much.
Thank you for watching this edition of Legislative Report. If you need further assistance with any government programs, please contact my offices. I have a district office in Berwick, one in Bloomsburg, and a Harrisburg office, and that contact information will appear at the end of this program.